Welcome to Team Essentially Healed training. I am Joni, your team leader, and tonight we are talking about pregnancy and babies. And again, I am Joni Zander. I'm a wellness advocate with doTERRA and an essential oil educator, as well as a silver leader and the team leader for Team Essentially Healed. The following statements have not been evaluated by the FDA. Products and methods recommended are not intended to diagnose, treat, cure, or prevent any disease. The information provided in this webinar is in no way intended to replace proper medical help. If you hear something that you want to implement and you are pregnant or have a small baby, I do recommend that you see your healthcare provider before you make any significant changes. This presentation is based off of a presentation from the 2012 doTERRA convention. I'm basing it off of Stephanie Fitz's presentation, and her presentation was titled Healthy Lifestyle for Mothers, Pregnancy, Toddlers, and Everything in Between. Today we're going to be answering two basic questions, and these are questions that a lot of people have when they're pregnant or have a small child. Question number one, does the Lifelong Vitality Pack have everything that I need for a prenatal or postnatal vitamin? And number two, are essential oils safe for pregnancy and for my baby? So those are the two questions that we're going to be answering. So Lifelong Vitality Pack is the perfect prenatal and postnatal supplement. It has everything that you need. It's very strong in omega-3s, which are really good for your baby's brain development. Because it's a whole food supplement, your body knows exactly what to do with it. So this is a great prenatal vitamin. If you are trying to get pregnant or you are pregnant now and you're interested in this and you're not sure about it, you can certainly you can go to doTERRA.com and pull up the product information pages, or PIPs is what we call them, PIPs, for each of these, and take them to your doctor and say, hey, I want to take these. What do you think? And your doctor's going to look at them and go, oh my gosh, that's a really good supplement. So don't just take my word for it. Another thing that you'll want to take while you're pregnant is the Terrazyme. There's a couple of different reasons that you want to take that. First of all, when you take it with food, it helps you absorb the nutrients in your food better. And when you take it on an empty stomach, it is really supportive of the connective tissue. Now think about when you're pregnant, you have a lot of changes in your connective tissue, and you're growing an entire human with their own connective tissue. And so taking the Terrazyme when you first get up in the morning and before you go to bed, along with taking it with every meal, will really help support you and your baby. And then the third thing that you would want to take is the PB Assist Plus. So this is our probiotic. It will help with an optimal immune system, and it actually helps absorb iron, which is really important when you're pregnant. All right, so that answered the first question. And then the second question, are essential oils safe during pregnancy and with small children? And I can assure you that the CPTG doTERRA oils are completely safe for use during pregnancy, and we'll go into that in quite a lot more detail. If you're new to our oils, CPTG means Certified Pure Therapeutic Grade, and it is a certification that doTERRA gives to ourselves because there is no certification for oils that are high enough for our oils. So our oils have a higher standard, and this means that the oils go through multiple third-party testing to ensure purity and potency, and the oils are grown in their ideal environments so that you're getting the best of the best always. Let's talk about essential oil solutions during pregnancy. So there are a lot of things that happen during pregnancy, and one very common thing is morning sickness. So there's going to be a lot of nausea and a lot of indigestion. And oils are great for this. So you can use peppermint or ginger or fennel or digestin, which has all three of those, on your abdomen. One of the things when you are pregnant and using oils, you want to dilute them down a little bit more so they can cover a larger area, because a lot of times you're putting them on your abdomen is a lot larger than it used to be, and you want to just make sure that you're just using some more mild oils. Make sure that you're using your common sense, and definitely listen to your intuition. With these oils, one thing that you might want to think about is getting the doTERRA Touch Kit. It's 9 different oils from our basic kit, so our Family Essentials Kit or our Home Essentials Kit, but they're all diluted exactly the way they need to be for each individual oil. So there's a peppermint touch, there's also a digestin touch, and those can be great for this situation. There's also a lavender touch. So for morning sickness, lavender, sandalwood, and ginger in a fractionated coconut oil, and then massage that into your abdomen can be very soothing. You can do that before you get out of bed, or you could take fennel, ginger, or peppermint in a capsule, or you can do kind of a tea for yourself with lemon and ginger and a tiny bit of honey or stevia. One of the things that's super common with pregnancy is lack of energy. Remember, you're growing an entire human, and to do that takes a lot of energy, and it also takes more sleep. And your sleep can be interrupted because your bladder's getting squished and you can't get in a comfortable position. And so there's a couple of things that can help with that with our essential oils and other products. And one of the things that can really help is the Mito 2 Max. That is another supplement. It's completely safe for pregnancy and can really give you that stimulant without any of the side effects, because it is, again, a whole food supplement. Another thing that's completely safe is the Serenity Complex supplement, and then you pair that with the Serenity oil for a restful night's sleep. You take the capsule a half hour before bed, and then you can diffuse the oil or put it on the balls of your feet, and especially the tip of the big toes. And when you think about your oils and you think about them in like categories, so our calming oils, lavender, Roman chamomile, frankincense, are all going to be supportive of sleep. Here is a recipe for a relaxation blend. So it's 10 drops each of Roman chamomile, frankincense, and bergamot. And then you put that in a 10 ml roller ball and fill the rest with fractionated coconut oil. It can be very conducive to sleep. If one of the reasons you're not sleeping is a lot of mind chatter, then you'll want to also add vetiver to this blend. Okay, so another like whole combination of things that happen. You have muscle aches, you have leg cramps, and your abdomen stretching in ways that it never has before if this is your first baby. So the best oil for stretch marks is Immortelle. And one really good recommendation with the Immortelle, because it is definitely a pricier oil, is you can use it around your eyes. It's really good on your face. And once you've used it, the bottle about halfway down, then pop that top off, the roller ball top off, and fill it with fractionated coconut oil again, and use that for your stretch marks in your abdomen so that it goes on a lot larger area. Another way that you can do that if you don't have a half a bottle of Immortelle, is you can just roll it, like do a little C in the palm of your hand, and then add some fractionated coconut oil to your hand and then rub it on your abdomen. Another thing that happens very common is leg cramps. You can soak your feet in a warm bath with geranium, cypress, and lavender. Cypress is super good for circulation. And then the sore muscles. So that really happens especially on the back. And so you can use your Deep Blue blend, and Deep Blue comes in a touch. So there's one that's already diluted down. Again, the lavender and peppermint also come in the touch. You could also use the past tense. The Aroma Touch blend is a fabulous blend for the muscle aches in relation to pregnancy. So that would actually be my number one, is the aroma touch. Also, lavender may help with early labor. So you just apply it to your abdomen to relax the uterine muscle. And then we've got super common swelling and water retention. So your body doubles its fluid by 28 weeks. And so the essential oils are really helpful to your body's natural ability to improve circulation. And again, the cypress and or the aroma touch are really effective for that. The aroma touch has cypress in it, and so either of those are really good for that swelling and water retention. And then the grapefruit, lemon, or lime in every glass of water. So when you're pregnant, you want to be drinking more water than you normally would. And that citrus oil in the water is just going to really relieve your liver and kidneys, those filtering organs, so that you don't retain quite so much water and you don't have so much swelling. All right, so you've made it through growing a whole human, and now we're going into labor. And so some oils that you want either have by your bedside for a home birth, or take to in your go bag if you're birthing outside of your home. Balance, you're going to apply that to your feet to really help you focus on the task at hand. Serenity or elevation will reduce the anxious feelings. It will stimulate the circulation. It's calming, or gives energy, whichever way you need. So that would be the calming serenity or the energy elevation. And then make sure that you have something for any kind of back labor. So that would be deep blue or white fur if you still have white fur. That is really, really good one to have. And then diffuse the wild orange and the balance in the room to calm everyone, because sometimes it's not mom who gets so anxious, it's the other people around her, right? So you'll want to make sure that everyone is calm and focused. One thing that you can do is take clary calm and white fur and lavender, and dilute that in a roller ball and put it on the abdomen for after the birth, like immediately after the birth. I forgot to mention that clary sage strengthens contractions. So you want to hold off on using clary sage until labor. So labor at this point would be a really good time to reintroduce clary sage. However, clary calm, with all of its other oils, even though clary sage is the number one ingredient in it, that's actually highly recommended during pregnancy to use daily to help balance those hormones, because with all the other oils, it ends up being very gentle. Okay, delivery tip. So Stephanie, again, is maybe I didn't even mention, she's a nurse midwife and delivers a lot of babies. And her recommendation is during delivery for perennial support, which I wish I had had when I was having my babies, helichrysum to create a lubricant oil for crowning. So take 20 drops of helichrysum with 2 tablespoons of fractionated coconut oil and apply all over the perineum area. This helps to stretch the tissue while minimizing swelling and avoiding tears. As someone who had a 4th degree tear with my first one and my second one because of the first one, I really wish I had had that. It also helps prevent bruising of baby's head. So helichrysum is the best oil for regulating blood flow. So highly recommended there. Also, just an FYI from Stephanie that peppermint may help to turn a breech baby. Again, these statements are not evaluated by the FDA. And then oils for the new baby. Yes, the oils are completely safe for your new baby. So frankincense also, again, comes in a touch version. So brand new baby, put the frankincense on the crown of the head and the spine. Just remember that frankincense and myrrh were both gifts given to the Christ child when the Christ child was born. because they're so supportive of this particular event, okay? So myrrh on the umbilical cord to help seal tissue and protect all systems of the body. And then put balance on the feet to ground and align the baby. The grounding is super important right after birth. And then also Melissa on the bottoms of the feet. And I'm not exactly sure why that's on that slide. I just know that Stephanie has a ton of experience. And so I'm sure that there is a very, very good reason why the most expensive oil is being recommended here. Postpartum depression affects 10 to 15% of new mamas. That's a pretty significant amount of new moms. And so there's a number of different blends that you can put together for your new moms. Make sure that new mom is making those daily healthy choices with the Lifelong Vitality Pack and really taking care of herself. A lot of times, grandparents will come to help, and a lot of times they think they're coming to help with the baby, but really they should be there to support the mom, and so that the mom can spend all that good quality time with the baby without having to prepare meals and take care of the house and all those other things. So if you are honored enough to be a support for a new mom, do everything you can to help her rest and bond with baby by making really healthy meals, making sure she has her Lifelong Vitality and she's taking it, and make sure that she's got these diffusing so that she feels really good. And Stephanie also recommends on day 4 or 5 a little TLC and a chick flick night. I think that's a great idea. And then breastfeeding. Several things that can happen during breastfeeding. The nipples can become dry and cracked, so oils to support that would be myrrh, geranium, or sandalwood with fractionated coconut oil. If the mom comes down with mastitis, then melaleuca, thyme, clove, rosemary, or wild orange and lavender. Massage into the breast and lymph nodes under the armpit. If you need to increase milk flow, what they do in the UK is a glass of stout beer will help get the milk flowing. But if you don't want to do that, then 2 or 3 times a day, massage either basil, fennel, or geranium or clary sage into the breast tissue. And of course, avoid the nipple. You don't want the baby to not want to nurse because of a weird taste. If you need to decrease the milk supply, which happens, that would have been really handy for me, then peppermint can help decrease the milk supply. And then, well, baby care. Okay, how many of you absolutely love this picture of this little one? That was actually what my hair did when I was a baby. That could have been me. So for overall well-being, frankincense on the back, balance on the feet every day to balance all of the body systems. If baby's a little bit jaundiced, then geranium and lemon on the feet to help support liver and breaking up the bilirubin. If baby has colic or tummy aches, then digestin or just fennel on the tummy. Again, look to those doTERRA touch oils for these, so that digestin touch would be a great one, the frankincense touch as well. And then if baby is teething, just a little bit of clove on your finger and rub on the gums. Can be really soothing for baby. And then just a reminder for new mom to maintain the daily health routine for her and the baby. So what that can look like is for mom, apply balance and on guard on the feet every morning. A drop of Melissa under the tongue every morning. 3 to 5 drops of frankincense under the tongue every morning. 10 drops of grapefruit in a capsule or under the tongue. Zendocrine, either 3 to 5 drops in a capsule or topically on the liver area. Lemon or grapefruit or lime in all of your water, drinking 3 to 4 quarts daily. Make sure that you're taking the Lifelong Vitality, also the probiotics, the PB Assist daily, and the Terrazyme, again, 1 or 2 on an empty tummy, morning and night, and then 1 or 2 with every meal. And then before you go to bed, use a few drops of your favorite stress-free oil. So Roman chamomile, bergamot, frankincense, lavender, serenity, or vetiver. That is the presentation. I hope that was helpful for you. If, as I was presenting this, you thought of someone who absolutely needs to know this information, feel free to send them the replay link.